thank God that it's all about the health, particularly the breast cancer awareness. So this is just a quick reminder to all of us as ladies. We remember that breast cancer is there, and we just want to remember those families who are still going through it. But as a girl, we just get into a habit of when we are washing, when we are bathing, we just look out for those lumps. When you bath, just make it a habit, a day-to-day habit that you just check if there's any lump there, check your breast when you are washing. It just be a day-to-day when you are washing yourself that there is no unusual lump on your breast. If there is anything, please don't ignore it. The message is don't ignore it. Go to your GP. We have a very good access of general GP practice. So anything you see in your body that does not look right, have a voice to say, I want to go and see my GP. I just want to thank God for the DOQ board who allowed me to come today. I want to just go straight to the topic that I'm going to talk about. Thank you. This evening, my presentation is going to be quick. I'm going to talk about periods. That's the first slides there. And then we want to talk about what is normal and what is not normal. And then we're going to look at the heavy menstrual bleeding and its management. And then we're going to look at breaking down the barriers. Nature has intended the girls and the women to have a monthly menstrual period. It is actually our nature to go through a monthly period. I know it's a subject that we don't talk about a lot. Right now, when we talk about periods, just tell me what's going on in your mind. Someone is thinking of, oh, I hate it. We all have different faces right now. When you just think of your monthly period, yet it's a natural, God-given nature that when your egg is not fertilized, the lining of the womb just sheds itself off, and then that's called a period. And the normal period goes for 28 days up to 38 days. It varies according to individuals. So it is a natural way for a woman just to have a monthly period. But this is a subject that is not talked about a lot. In our community, in society, we don't talk about it. It's taboo. You know, people think, oh my God, there's a stigma about it. It's shameful to talk about periods. Yet it's very natural. It's a natural way of a woman or a girl. And there's also a culture barrier that we just don't even discuss about a period. We have girls now who start their monthly periods at the age of 9. And you know, I remember when I was 9 years, I don't know anything. I was just playing, we were playing. But now our young girls are starting periods at the age of 9, 10. What do they know? And they just go there quietly. We don't discuss about it. And they experience the heaviness. So we're going to talk about the heaviness of the period. But no one talks about it. Our fathers, our brothers, they don't know about it. But now we are saying, we are bringing an awareness. It's not that we don't know about periods, but it's bringing that awareness that there is a normal bleeding and there is what we call not normal. Some have missed school. They missed a number of days not going to school. And we don't talk about it. We don't address it. Because when we bleed a lot, there is a tendency that when we lose blood, some people have become anemic. That's why I don't know if I ask in this table how many people are on iron tablets. There we go. How many people are taking iron tablets because the GP has told you are anemic? How many people are constantly tired, all because of these periods? But we don't talk about it. Sometimes in my consultations, when we do clinics, we are now coming, we are trying to do away with the culture barriers. We find even Asian parents, because maybe the mom can't speak English, we find the father bringing the daughters, and we talk about periods. So it's now we are trying to break that barrier that we talk about periods even even with our own brothers, they should know it's a normal process of a woman. So when we start our periods, we call it menarche. When you start whatever your first time, that's your year, that's what we call it. And because of the group that we are in today, we just concentrate on that time. The rest, it also for just all the women, but we just want to concentrate on the younger group, that where we are from the age of 9, 10, when we've started. So all our lives, we'll be talking about periods. And some people experience different. Some people will tell you, oh, my period is normal, I don't have a problem. But some people, they'll tell you, oh, I'm a bleeder. Or in our family, we bleed, you know, and we've just taken it normal. We say, oh, we are just bleeders. So there is nothing like that we are normal bleeders. But if it causes you not to have a good quality of life, I consider that not normal. And then when we go to the Word of God in Leviticus chapter 15, it all goes back to this chapter 15, verse 19 up to 25. When a woman had a regular flow of blood, which is about 7 days, she'll be isolated. If you read through right up to 25, when a woman has her monthly periods, she wouldn't even interact with other people. She doesn't go to gatherings. She doesn't meet with other people. So this was in the Bible. That's why you find so many cultures up to today, they are still practicing that. You find even Asians, when a woman a girl is menstruating, they don't even go to a wedding. They don't socialize with others, because according to the Word of God, it's unclean. You are unclean. So when you are having your period, they consider you unclean. So you find women, they are girls, you are so isolated. Some, they don't even go to functions, because you'll be thinking, oh, I'll be bleeding. But when you look at this verse, it says, even if you have a period for 7 days, when it goes beyond 7 days, you are still considered unclean. No one should come near you. No one should even touch you. Anyone who touches you is considered unclean. Anyone who even stands next to your bed, according to this verse, you are considered unclean. So we can see, even in the biblical times, going way back, a woman has always been isolated because of a period. We are always having that stigma. We don't talk about it. And when we talk about periods, someone already is thinking my cupboard is full of painkillers. I've got ibuprofen, I take Menafanic, I take paracetamol, but all this is not working. And when we talk about periods, someone is already saying, I've got my hot water bottle for the cramping. Sometimes we cramp. This is us girls. And then many women, girls, they've become anemic. So there's actually a World Day where they say women are anemic. There's anemia day. So it shouldn't be like that. There should be a way around it. We ignore the causes. Sometimes the doctor just prescribes you tablets and that's it, and then we go. There is a lady who came to us with her daughter, and then she commented and she said, my GP told me that if only every woman, every girl who came into the GP practice says I've got a problem with my periods. He said if was getting paid £5 for each person, you'll be a millionaire by now, which shows that women bleed, but what is not normal and what is normal is what is not being addressed. So my standing up here today is bringing the awareness. What do I say for the doctor to see me and take me serious? What should I say when my periods don't seem to make sense? So what is normal, according to the NACE guidelines, is a normal monthly period is that gives you a minimal impact on your daily life. So you can do your sports, you carry on with life. Some people have 3 days, 4 days, no problem. Their flow is okay. But that's what we call normal. It does not affect your daily quality of life. And the amount of flow is less than 80 mils of blood loss, and it lasts less than 7 days. That's what we would consider normal. But now when we go to what is heavy menstrual bleeding, anything that is prolonged, heavy periods, in the medical world they still call it menorrhagia, but we are moving on. We are now calling it heavy menstrual bleeding. What is abnormal? Any period which takes you more than 10 days, more than 14 days, 20 days, It's not normal. I have seen women, girls, young girls, even at 13, they go for a period which goes for 21 days. Then we have to question, that is not normal. Why I'm saying this is because some people, you are nurses, you are doctors, you are teachers at school, but we experience kids who have a monthly period which goes on forever, and you ask yourself, this child is not concentrating in class. They are anemic, they are losing blood every day. So that is not normal. If you've got a sister, a cousin who's going through this, we are here to signpost. My role here is just to signpost to you, what do you do when you've got such a flaw? And then another thing that is, we can say it's abnormal is when you have, when you wear a pad, even on top of that, when you put on a pad, you put on a tampon, but you still have a breakthrough flow on that. That is not normal when it's very heavy. We have some girls who wear a maternity pad. A maternity pad, it still goes through, it's still running through, you still soak that pad. Some, they wear night pads, you know, the thick ones, but they still have a flow that is going through. That is not, that doesn't sound normal. And then some have breakthrough bleeds in between. So there's a time when you have a normal period, and then at day 14 when you're ovulating, some people actually bleed. So sometimes you ask yourself, is this a cyst around your ovaries that causes you to have an extra bleed? So all that needs to be attended to. And then passing a lot of clots and flooding. How many people flood? I know we don't talk about it, but so many people flood. When I say flooding, is when you are sleeping, the whole bed sheet, you just wake up in a swimming pool of blood. That is not normal. When you are flooding, you flood throughout those 7 days. That is not normal. And some girls, they pass clots. You know, some of us, they send us pictures in the clinics, passing serious clots, horrible clots. You think, what is this? Is this liver or something? And they'll tell you, that's what happens in our family. That is not normal. So I want to say, let's not accept some of these things. It's not normal for you to flood like that and have clots as well. And then erratic periods, that is also subjective. Erratic periods can be caused, especially the ones where from 10 years, maybe up to 18, your ovaries, you are still developing. So sometimes they can be erratic because your hormones are still developing. So all these things, an abnormal period is subjective. Why I'm saying subjective is how you describe it. Is it causing your life to be miserable? Any period that is affecting your quality of life, I would say, please go and see your GP. In this country, we have a very good system that everything, if you go and see the GP, will signpost you what to do and where to go. Without seeking for medical help, a heavy menstrual period can reduce your quality of life. Some, they feel so depressed and they don't even talk about it. And it reduces your mood and the tiredness. And a lot of girls, they miss school, and some even college days. Some people even at work, they know you that every 2 months you've missed your period. You're missing work because of heavy periods. Anemia is one of the things because we lose a lot of blood. We find a lot of girls, we are very anemic. You find, you say, this one is always tired. Why am I talking about these things now as girls? We are the girls who are preparing to go to get married one day. You'll be having your own daughters. Or when you are married, the husband is saying, this woman is always tired, always sleeping. Why? But she's never mentioned that I have heavy menstrual bleeding, which has affected her life to that extent. So we want to say, let's be aware and let's seek help. And then the question is, when do I seek help? So there's some people who have periods when they feel dizzy, and immediately some girls, they even faint. And when you have to change your periods every 2 hours, like your tampons and pads, you change them every 2 hours, then we have to go and seek for help. Now the question is, what do I say when I go to the doctors and say, so that I can get the attention? Because sometimes we can be brushed away, say, women bleed anyway. So how do I bring up my question to the doctors to say, so that I get their attention? You tell them that it's affecting my quality of life. And then don't be dismissed, girls. when we are talking to the healthcare professionals, anything that is affecting your quality of life, it has to be addressed. When you say it's affecting my quality of life, I'm not able to do certain things. Girls at school, they feel isolated. They don't even go for sports. They don't do other activities with other kids. Then the GP can attend to you. You actually have to explain as well the nature of your bleed. Because sometimes the doctors say, women have bleeds anyway. But when you tell him that I have a period which goes on for 20 days, then that calls for action. There are doctors now, we are going in a campaign that they refer them to us, they refer them to hematologists. We are also talking to hematologists that when you see patients in your anemic clinic, don't just address the anemia. Find out what is the cause of this kind of a bleed. We have kids sometimes who come to A&E with a low HB that they are fainting. I've experienced girls where we have to give them iron infusion, blood transfusion, just from a heavy period. So that needs to be addressed. So we have a special clinic when we deal with those issues and address them. And then one of the causes of heavy menstrual bleeding, and it's, if you look at the causes, those who look on internet, 24%, you ask yourself, could it be a bleeding disorder? We have a few bleeding disorders which go undiagnosed because we don't talk about these things. So what I would ask is, you have to ask in the family history, deeper, is there any easy bruising, nosebleeds, things that are prolonged, they are not normal. So our GPs now, they are being taught they can refer people to our bleeding disorder clinics, hemophilia, or even a hematologist. We are talking to them that when you see patients, please just don't do a full blood count and iron only. Because when it ends there, you're sending someone off with just iron tablets. But now we are saying do the clotting screen. A clotting screen is when you actually see how your blood is clotting. So when it's prolonged, then they are referred to us for further investigations. So we also say when we are seeking for help, sometimes it might not be even anything to do with bleeding disorders. It could be even an abnormality in your body. Someone could be having a fibroid, or someone could be having cysts around their ovaries. All these things you can request for a scan. When you think this is beyond me, girls, mothers, we are allowed to request for a scan, an ultrasound scan, just to scan if the anatomy of the girl is in place. So we have all that opportunity in this country. We have free access to health. And these are few treatment options, which are girls with heavy menstrual bleeding that we give them. Tranexamic acid, it reduces the flow, it reduces even the number of days. But all these things need to be prescribed appropriately. Hormonal treatment, we have those, but they have to be prescribed under the gynecologist. And I want to say this one on hormonal therapy treatment. We have some of our girls here, or in general, who are going on internet and they are buying a tablet called northisterone. It's a hormone that postpones your period. Because your period is so heavy, they go online, they are buying tablets, which are actually saying, I'm avoiding to have a period. So girls are on that tablet, they go for 6 months, 7 months without having a period. But we are discouraging you to take those tablets, hormonal tablets, which you buy online without the GP, the doctor's advice. Because when you want to have children, all these things play up with your hormones. So we are saying avoid buying all those things online. And iron tablets, some people react to iron tablets. We also can be given iron infusions. So all these things you can request, but this is just an awareness. And Mirena Coil, probably this applies to women who have children. These are girls, but there are options to control and give you a good quality of life for menstrual periods. And Mirena Coil is different from a copper coil. That's I think for the married women, because one has got hormones, one doesn't have hormones. But all these are there to control your menstrual bleeding. And then breaking down the barriers. We are saying girls of quality. We want you to have a good quality of life when you have your menstrual periods. I want you to have a voice. What is not normal when you think I'm cramping. I cramp 7 days. I'm not going to work. I'm missing everything. Have a voice. We are here to signpost you. Go to your GP. You know, they can signpost you. The quicker you see the healthcare professionals, the quicker all these things can be diagnosed. And now when we are breaking barriers, we are now talking to the fathers. We are talking to male so that they understand when a wife is saying, I'm anemic, what does it mean? You say, where did you get that from? And then when you go to the bottom of it, we find that they are having heavy menstrual periods. So we are saying, let's break the barriers. Let's talk about these things at home. Let's talk about it with our brothers and our fathers. And then to say to the girls who are still in school, I did not know about this one, managing periods in the class. Did you know that you are given a pass? There's a toilet pass. I didn't know about that. So some girls, you get ashamed, you get embarrassed in class because you soak your you know, when you're having your period, you soak your clothes, you spoil them because they don't have a pass, a toilet pass. There's what you call a toilet pass. I discovered it because my own daughter, she was not allowed to go and change when she was on her period, to go and change her period. This is here in United Kingdom. Some girls can't go and change their pads because maybe if you are going every 2-3 hours, the schools don't allow you, so they get a pass. There's a toilet pass. So just find out about that. But these are the things that are demeaning women, girls. We are demeaned. We are ashamed to talk about these things because now the whole class will know that I'm having a period. The boys in the class will know that you are having a heavy menstrual period because if you don't get a toilet pass, you spoil your clothes, all these things. So young girls, I'm encouraging you, just carry an extra bag when you think I'm having periods, carry an extra panty, a few things in when you're going to school. And you know, it happens, but find out about this toilet pass in school. And I'm speaking to teachers and mothers. Find out your girl, is she allowed to go and change her pad when it is the time for her to change? Because it's humiliating every time that she stays there with a soft pad. So we are saying, teachers and other people who are in the healthcare profession, please let's accommodate our girls. When she wants to go and change, allow them to change. And then online, for girls to manage their, to actually look after your flow, your periods, there's an app which is called Flow. So you're able to manage that period. You look after your periods. You know your pattern. And then when it changes, the app will show you. So also take that to the doctors when you think your periods are not regular anymore. And those who come from Scotland, can I see people who come from Scotland? Anyone from Scotland here? Yes, I'm excited to inform you that Scotland is the first Scottish country, I can say, first country in the world who lobbied for our girls to have free products for their periods. So that lobby was passed in the government in 2020, and now if you go to Scotland, there are places where you are actually allowed to get free pads, free tampons, all those things just to make sure you have a good quality of life. So, and there are apps which can make you have those packages online for free. And then just to say, as I'm sitting down, breaking down the barriers, there was a woman in the Bible who was bleeding for 12 years. But you know that woman, when she was bleeding, she was not allowed to come near people. But when she saw that her situation was so bad, 12 years, can you imagine when you're bleeding for 12 years? She must have been smelling, she must have gone to doctor, she must have tried everything. But this woman, according to the word of God in Mark, she touched Jesus' hem. Why was she scared when she did that? Because when you are having a period in the culture, in the Bible, you were not supposed to touch anyone. So she had to sneak in and touch Jesus because she was considered unclean. She had to hide, she was embarrassed, she was scared. She had to risk her life because you touch somebody, that person is considered unclean. And Jesus that day was on a movement going to heal somebody. So he said, somebody touched me. But you know what? According to her faith, she received her healing. So I'm saying to somebody, if we are saying periods are bothering you, there is still Jesus. You can can touch him and he can heal you. So thank you for giving me this time. Feel free to contact us. Thank you.